Hi, fools, and welcome. Today, our guest is CEO of Omada Health, Sean Duffy. Omada is a rapidly growing virtual first healthcare provider that recently debuted on the public market, addressing major chronic and cardiometabolic conditions like diabetes and hypertension through clinically validated behavior change. After reporting strong third quarter results that included 49% revenue growth and reaching key profitability milestones, we're asking Sean how Omada plans to distinguish itself in the crowded digital healthcare space and generate sustainable returns for investors. So welcome, Sean.
Thank you for having me. Excited to be on.
Yeah. So congrats on the IPO and the strong third quarter results. Taking a step back, the digital health space is pretty crowded, yet chronic disease remains a massive problem. What was the critical insight that kind of led you to found Omada a decade ago? And how does your virtual first between visit model focus on behavior change fundamentally differ from, pure telemedicine service?
Yeah, absolutely. So the quick basics on Omada. So hi everybody. So Sean Duffy, co-founder and CEO. So I founded the company while in medical school, and so it worked. It worked in technology. It worked at Google. Then went to med school. Was in the MD MBA program at Harvard. And just in front of me on a daily basis was a very obvious gap in the way that care was delivered, in that it wasn't proactive, it wasn't day to day, and that wasn't a good fit for chronic disease. And so, I'd sit with patients with obesity, metabolic diseases like diabetes, hypertension, and ask, well, what has the healthcare system offered? And the common answer was, well, I had a visit with my doctor and I got a medication prescribed and they said, come back in 6 months. And the obvious was that not only was that visit-based approach not effective, it was the totally wrong kind of care for the 156 million plus Americans suffering from chronic disease. And so that led to, Omada, recognizing, well, there needs to be a new way. Care needs to be delivered differently, especially for diseases where you need that support on a daily basis to have someone in your pocket, in your corner, really with you if the country were to improve health outcomes, relative to the disease areas. And so that's been the goal from day one, germane to the mission. To specific to your, commentary on it being a dynamic market, that's certainly true. The one thing I'd offer is there's the consumer side of digital health, folks that advertise directly to people, get them to sign up, self-pay, and then there's the enterprise side. Omada is an enterprise company. Our solutions are reimbursed by either employers that are self-insured, fully insured health plans, government-sponsored plans, and so that is a key difference. And in our view, that space is a little bit less, less noisy, if you will.
Yeah, perhaps stickier and a little bit of a higher retention once you get those contracts in.
That's right. So the revenue model for Omada really starts with showing our 30 peer-reviewed publications to employers, to health plans, showing the clinical outcomes, the economic outcomes, really helping illuminate to them that the existing system that we saw in action when I founded the company doesn't work. And then if they choose to reimburse for Omada, then when a member signs up, we start to bill all through the person's insurance, design. And so it is a stickier model. We love the revenue model because it creates very solid customer cohorts. You get a lot of visibility, and that's one of the blessings on being on the enterprise side.
So I know in the latest report, you announced that you had 53% year-over-year member growth, which is phenomenal. You're up to about 831,000 as of third quarter 2025. Just so we kind of get the listeners to understand who actually is the customer. And you kind of referenced that, but with 831,000 members, how does that kind of play into, how your core revenue engine works?
Exactly. So when we say member at Omada, externally and internally, that's someone who's actively under our care and support, and we're actively billing on. And so, that member is directly, member growth is obviously directly tied, to revenue growth. Because again, when someone signs up, then we start to charge. It's a monthly fee, kind of like a membership fee. It includes everything we do. It includes our care teams, it includes our hardware, you name it. And it's that monthly fee, and we keep billing that such that someone, continues to need us and use us. And so that's that 831,000 Q3 25 result at 53% year over year growth. Every one of those members isn't self-paying. Their insurance designs paying, for Omada for them. And in the US, that can be various kind of categories. The three most common would be self-insured employers. So if you're an employer of sufficient size, typically you self-insure. And you still use a health plan to help you process the claim, set up the benefit, but at the end of the day, you're paying the cost. So that's a customer type for Omada. There's a health plan that's fully insured, where the health plan is, paying the claims directly, or there's, things like Medicare Advantage, where it's government sponsored. We do work in, all of those areas, and have well north of 2,000 customers as of June, 30th, 2025, and that's those are basically the financial sponsors behind those 831,000 members.
Got it. Yeah. So we have something, at Motley Fool, we are, I believe we're self-insured, and so we have some services we can sign on to that are part of our benefits. So let's say I hurt my lower back. I'm in my late 40s. I'm at the gym, and it's like how that can kind of go. And I jump on and I see, Omada, they got musculoskeletal care. Let me sign on, and I sign on, and I use it for 2 or 3 months, and I'm like feeling better, and said, okay, I think I'm done now. I'm gonna kind of step away, and then so are you paid just for those 3 months, or how does it work from that perspective? Is it usage based from the member?
It is. So it's tied to engagement, in that instance where if you're like, all right, job's done, that's somewhere if we're not delivering the service, we wouldn't charge. I will say in like obesity, in diabetes and hypertension, they are a little bit more chronic, so folks tend to have longer levels of needs. I mean, we have shared that. So at the end of 12 months, let's say you start 100 people on Omada. I mean, at the end of 12 months, you'll have north of 55 still engaging monthly. You look out to the end of 24, you'll have north of 50 engaging monthly. So you kind of hit a plateau where folks feel like Omada is just part of their daily rhythm, part of their care plan, part of how they how we support their health goals specific to the diseases that they have.
Yeah. So you're targeting some of the most, large markets, some of the most pervasive and expensive health conditions. What kind of specific data best quantifies the size of these unpenetrated market opportunity for Omada? And given the massive scale of diabetes and hypertension, how are you prioritizing which condition or geography you kind of tackle next to maximize shareholder value?
Yeah, I mean, the end markets are enormous. I mean, we've got, as shared, north of 156 million Americans suffering from chronic conditions. You've got 40% of adults having 2 or more. In 2022, diabetes alone was one in every $7 spent. And so these are really, really big TAMs. I mean, if you add up prediabetes, diabetes, hypertension, MSK, it's, well north of 100 billion in TAM. And so Omada, we began our journey in prediabetes, obesity, and then later in our chapter, in roughly 2019, we started expanding to diabetes, to hypertension. A little bit after MSK care. That was not seeking new TAM. It was in response to customer preference and convenience to work with one company, more as a platform company that could support their employees across key clinical needs that fit this between visit care rubric versus seeking new market opportunities. So, the explicit mission of Omada is to bend the curve. We mean bend the curve of disease, and that's germane to the early days of Omada, where I tell the teams, look, success for us is tomorrow's epidemiologists. They notice a bend in the disease incidence and better trends, and we have to be part of that answer. So, while we're enormously proud of the scale, the growth, we equally recognize that we have not bent the curve yet, and we have to keep the scale of our ambitions, extremely high, and hopefully one day get to the many tens of millions of members versus the 831 we're at now.
Yeah. So that between the visit is really interesting. It kind of distinguishes you from some of the other digital health space players out there. You're focused on, you don't have physicians necessarily on your staff, right? You have health coaches and others, nutritionists, I believe, and others that might help between those visits, coaching, support, everything. I mean, because healthcare is such that you go to the doctor, you get treated for something, you get some plan, and then you go home and you start it maybe, but you're kind of lost. You don't know what to do. You get discouraged. That in between is really important to kind of keep that health going and people sticking to what they're doing. So you can talk a little bit about that as well.
Yeah, I know you're spot on. So a very common experience in the U.S. healthcare system is, you have obesity, you have diabetes, you're at your doctor's office, and they hand you a pamphlet. And so, in the founder's letter as part of the S1, I think I quipped that Omada is kind of like the anti-pamphlet. Because pamphlets don't work. You really need that support and follow through, and someone like listening to your goals and saying, interesting, you haven't been taking your diabetes meds. Why? Maybe you don't like the side effects. Maybe you're just forgetful. Maybe they're too expensive. So, really like that ability to support someone on a day-to-day basis is germane to clinical and economics outcomes in this space. And it did require the creation of an entirely different care model. So it was my reflection, having lived, a bit of time in medical school, seeing the healthcare system, up front, is that just the handcuffs of this fee for service, visit by visit billing model, mixed with all the operational models, the technology models, the regulatory models, were just not well suited for chronic disease. And here we're faced with chronic disease is the issue in healthcare, as we've seen relative to the epidemiology in our population. So it's been very important, to think, well, what is the right care experience? What are the right personnel? What's the right hardware? What's the right software? And in that, we recognize that what we need to do is complement someone's PCP. We think that members should have a medical home, obviously be getting care elsewhere, than Omada. But the right care professionals for that between visit care are folks like certified diabetes education and care specialists, health coaches, LCSWs, physical therapists, obviously with MSK. And so those are the personnel that we use in our kind of vision of people meets technology.
Mm-hmm. Awesome. So, in your communications, you talk a lot about clinical validation. In kind of simple English for our investors, what specific evidence do you provide to kind of a payer to prove that, enrolling members in Omada's programs is going to generate them a positive ROI, like not just in health terms, but also like maybe cost savings?
Yeah, no, it's very important. This is in the enterprise side, we view this as one of our moats. Because when you go into a health plan and try to make the case for covering your solution, the receiving end of that case is a very sophisticated buyer that has a team of medical experts, actuaries, you name it. And so really from day one, we've invested extensively in clinical research at Omada, seeking to publish the results both of clinical outcomes as well as economic outcomes in peer-reviewed journals. And we're proud that we have 30 peer-reviewed publications now, and these range from quick observational studies where you follow a specific cohort over time that is a little bit speedier, to multi-year, multi-million-dollar Omada-sponsored, level 1 randomized controlled trial evidence. And so those data have enabled commercial success and differentiation from Omada, and you're spot on. The buying market needs to see clinical outcomes as well as economic outcomes, and so we've structured a set of our publications specific to really the ROI and the economic side, which you as a buyer you can kind of estimate an ROI of about 3 to 6x depending on program when looking at gross savings over 3 years.
Awesome. So kind of shifting over to, as investors, we're always looking at the numbers and the financials and such to kind of gauge how the business model's working. You had a great third quarter report showing strong revenue of $68 million. The market was focused on the market kind of focuses on, for early stage companies like yourself, on the path to profitability. You had the big news that you achieved a positive adjusted EBITDA of $2 million. What was the kind of single biggest operational lever, whether scale, efficiency, or pricing, that you kind of pulled to hit that milestone? And kind of what's your current guidance on the timeline for achieving, GAAP net income sustainability, profitability?
Yeah, so I mean, we're very, very proud of that. I think the how is something that's not often articulated, but I'm equally proud of the how because just a continuation of trends, and we've purposely at Omada sought to undertake an orientation of no unnatural acts to try to like manufacture profitability or like shape the P&L. Is really a continuation of the key strategic trends and themes that we've seen, highlighting two single product and multi-product, going from one thing that you can sell to your customers, pre-diabetes, obesity, to four gets leverage in the business. And so, at the end of last year, we had over 30% of Omada's clients supporting more than one Omada product. And the great thing about the leverage, which is of course associated with the profitability picture, is you really don't need four sales reps to sell four products. So you get a lot of leverage on your sales and marketing expenditure. And so that was kind of a key piece of it. And kind of the second is more of a moment in time. I mean, my wife jokes that I don't know any other acronym besides GLP because it's all she hears me talk about. I mean, we're in the thick of working with employers who are choosing to cover or not to cover the meds. We launched our GLP-1 Care Track, which is something that's been in market for a couple of years now, where employers can choose to turn that on to best support health outcomes for their employees on GLP-1s. And so there's been a neat spotlight on metabolic disease right now, which is kind of a great thing. And Omada, is at the center of that, which we love.
Yeah, your GLP-1 programs, were probably a primary factor in driving some of that, great member growth. Are you seeing them as a new separate revenue stream, or are you kind of seeing them as a member acquisition tool where you'll attract new members who can maybe be cross-sold into other, cardiometabolic or behavioral health programs?
I mean, we do view it as new. Equally, we want to make sure that people understand the substance of what's happening in the market. So we recently put out year-long data that shows Omada's ability to help support for someone who chooses to discontinue the med and keeping the weight off. So that's great. We want to, if that is the goal of our member, we want to help support that goal. In that, we did share that this was in September data, we did share that we're north of 100,000 GLP-1 Care Track members. So it is still the minority of our member base, but what is happening is that Care Track can be operationalized through either Express Scripts now or CVS Caremark. And so equally, both of those PBM relationships enable the employer to turn on all of our products. And so oftentimes a door will open because an employer's interested in this Care Track, thinking about the dynamics of GLP coverage, the cost, you name it. And then the conversation will quickly turning out to rolling out the broader Omada suite. So GLPs is really a kind of rising tide lifts all boats for our sales motion here. If it's the first thing that employers think about relative to bringing us in, that's not where the conversation stops. It's where it starts.
Mm-hmm. Yeah, in your slide presentation, you have a slide that talks about significant comorbidities, and with people that have 74% people who have diabetes also have hypertension, 58% of people who have diabetes have musculoskeletal conditions. So what I've always seen GLP-1s as is it's almost like the core issue to tackle to kind of relieve some of these other things. So, I mean, it's almost like if you're able to attract people through GLP-1s, you're able to offer them not just the weight loss, but the guidance and the understanding that, well, this is going to help all these other things too.
Yeah, no, I mean, they're obviously really amazing medicines, and we view our Care Tracks job as helping to support maximizing the pros and reducing, the cons. And what we found is they can really be great catalysts actually for behavior change counterintuitively, because someone might join Omada's GLP-1 Care Track. I mean, imagine if you had a BMI of 40 and had really struggled with obesity, and all of a sudden the ball's rolling downhill. you're more open-minded to thinking through, well, what does a week in your life look like from an eating behavior standpoint? You're open-minded to working with Omada on new physical activity plans and structures to ideally reduce things like muscle loss. So that catalyst can be really, really remarkable, but it does need to be seized. I mean, a GLP is an incredible thing for quantity of calories, but alone it doesn't support quality. I mean, you need, an injection's not getting to know you. And so, Omada's job, we believe, is to really get to know our members and help support their goals, and amplify their weight loss while on the med. And if they do want to discontinue, support their continued weight health.
How much pressure or competition do you think you see from the PBMs that may vertically integrate into their own digital health bundles and say that this is something that we want to kind of do ourselves?
They've been partners. Express Scripts or Evernorth has been a long-standing partner for many years. They, when seeing our GLP-1 Care Track, selected us to be part of an offering they have called Encircle RX, which is a GLP-specific offering. More recently, we're part of the CVS Caremark Point Solutions management platform. We have found, especially with care services models, alongside medicines, they've been great partners, and that's great for us because it allows a benefits leader to work with Omada without having to directly bring us through a contracting cycle. They can kind of flip a switch. If they leverage either CVS Caremark or Express Scripts as part of their benefits ecosystem, and for the PBMs, it's a great way to listen to customer needs and be responsive to the fact that their customers, which at the end of the day, it's a lot of employers. It's not only employers, but a lot of employers, really have to grapple with decisions around GLP coverage and ancillary support.
I was very impressed with your the high degree of operating leverage in your model. You have 66% gross margins, especially for kind of a tech human coaching hybrid. When you look at your cost structure, your coaches, technology, distribution, what's kind of the most significant opportunity to push that margin even higher in the next 2 years, and kind of what creates a structural moat around that margin?
Yeah, so the neat thing about, again, the how there is a big piece of being able to deliver a really kind of a human plus technology experience with compelling margins was actually a technology investment. So we in the early days decided to build our entire care team platform ourselves. Think of it as like Omada's electronic health record. Mm-hmm. And we looked out there would Epic work? Would Cerner work? Would any of these others? And the answer was no, because those are built for fee-for-service care. And they weren't built for longitudinal care. And so we did have to make the tech investments needed to build out that entire layer. Sometimes I think of it as Omada's crown jewel that nobody sees, but it allows our care team members to wake up with an organized inbox. It allows us to leverage AI appropriately, safely. It allows us to really focus on supporting the right members at the right moment in time with our people. And that's one of the reasons that's led to not only margin improvement, but just ability to grow to the 831,000 member mark with consistency in quality. And so that's been very important. So that's a little bit of the how relative to the opportunity. There's the things that we think just shape themselves, which is continued multi-product support. Also is accretive to margin targets because we have different price points and margin profiles across the different product areas. So as we continue expanding to diabetes, hypertension, et cetera, that helps benefit the margins. And we have kind of put out our long-term margin target of north of 70. And as you highlighted in Q3 25, GAAP margin was 66%, non-GAAP margin was 68%. So nipping at that, which is great. And then equally, there's opportunities. The neat thing at Omada is there's opportunities on the cost side. Volume with hardware, more efficiency with care team members, but even perhaps more opportunity on the quality side, because if folks engage longer with Omada, we're getting more revenue on the same cost structure. And so that's actually accretive to margin too. So our product team, as they think about all the hundreds of dials they might tune to create that next generation Omada experience that is even stickier, that has even better engagement, that's actually margin accretive too.
So, after having completed the IPO, how is your capital allocation strategy kind of shifted? Are you still prioritizing organic growth and R&D, or should we expect to maybe see some appetite for strategic M&A to kind of expand your condition coverage or market reach? How do you see that going forward?
I mean, I think in the years leading up to IPO, we were, pretty disciplined relative to what we underwrite. A, making sure that it's on strategy, on the explicit strategy. B, figuring out the right portfolio of investments relative to what will yield, more immediately, and underwriting that relative to what will yield or could yield on the longer arc to make sure we're planting seeds for the future. So with that, I don't feel that that's changed. I mean, we think of it as responsible growth. We do love the leverage we're seeing that we think is allowing us to make some neat investments while still maintaining progress on the P&L, like what we announced at earnings, adding the new prescribing capability, which is really exciting. I mean, that doesn't we don't believe that yields materially next year. That's more of we're placing that bet for next year's sales cycle to support 2027. So we are positioned to do that, and then I think specific to M&A, what I always share is look, we'll keep an open mind. Omada's orientation tends to be more organic. I mean, these are huge end markets. We've got organic growth going very well. We differentiate on product integration, member experience, which isn't always, but can be at odds with some M&A. So we'll keep an open mind, of course, but the bar is pretty high right now.
Yeah. Since behavior change is kind of the core of your service, and what is kind of an important metric you use internally to kind of measure your user engagement and adherence? For example, daily active users, completion rates of a module, or something else, and kind of how does Omada kind of stack up in the industry with that?
Yeah, I mean, so the most important one is, of course, what I shared, which is, all right, look at the end of the year, what percent of people are still leveraging Omada, and as shared, that's north of 55% where we're still billing monthly. So that's the most important. Within all of those, there's dozens and dozens and dozens of sub-metrics that we measure internally. Even things like ability for care teams to build rapport in the early days of the Omada care experience. We know that moment matters a lot. It's like first impression. It's a moment where our care team's getting to know the person. So there's a whole lot of quantification internally on the product metrics. It's sometimes hard to find benchmarks, externally, given we're an enterprise company. It's kind of like a tech meets people model. But we, with my consumer friends, when they see our engagement curves, like, oh my gosh, incredible. So it's not the world we live. I think when you're an enterprise company, it affords your ability to, put forward a little bit more cost and resources to ensure that you're meeting a member need, which is again, one of the you've got incredible companies like the HIMSS on the consumer side, and Omada is kind of an enterprise company. So
member churn is always a struggle for so many of the digital health services, even fitness, wellness, any kind of industry, any kind of service in that. You have pretty impressive current client retention metrics. What would you say is helping that?
Yes, on the customer level, which is north of 90%, and the actually most common reason we lose a customer is they maybe switch to a health plan where we don't currently have a relationship, and that's just trust. It's delivering on engagement, on outcomes, on operational capability, and deploying the solution. When you're in a market like ours, your aspiration to meet the commitments you make to your accounts is hugely important. So that's great. And then at the member level, which we've talked about, I think it's the combination of people, hardware, and software. Mm-hmm. I sometimes joke that we have 6 digital health companies in one in Omada, because you can find connected scales, you can find content, great health content, you can find social communities, you can find great tracking apps that track fitness, you can find activity tracking apps, you could find even one-on-one coaching. And our view was that any one of those things alone couldn't get the job done in the care areas we're in. So we had to kind of build them all. And when you build the mole, you create really a feel with a member that all of a sudden they have this like showering of resources and support to help them achieve their goals, which results in the stickiness and retention.
Yeah, I mean, ultimately, in any of these business, when you have the customer and they feel like they're getting the support they need on these journeys, that's when they're gonna stick with it. And maybe even having a little bit of fun and satisfaction from using the service.
Yeah, 100%. I mean, it should feel that you have, perhaps for the first time with some people, like a team in your pocket, in your corner that you've not had before. And it's not, hey, call me when you have a problem. It's, hey, how are you? Tell me more about you as a person. What are your goals? My number one job and my only accountability is to support those goals.
Yeah.
And that's that's kind of the opposite of what most people feel in healthcare, which is extremely reactive. Omada is incredibly proactive, which is what you need toward a care model in chronic disease.
Yeah, yeah. So shifting a little bit towards risks and things that maybe might keep you up at night, or investors up at night. A lot of the B2B health companies, concentration of revenue with kind of a few large payers and employer contracts tends to be an issue. And how is Omada's kind of current revenue breakdown expose the company to meaningful concentration risk or not? Would the loss of one or two major contracts really significantly affect that kind of revenue growth trajectory that you have? And what are you doing to kind of expand that client base a little bit more?
Yes, it's not, per your point. I mean, it's not an uncommon thing, especially if enterprise healthcare is pretty consolidated. I mean, if you look at the PBM landscape alone, there's three PBMs take up the predominant of the market share there. So we are proud of our traction with all of our partners. Oftentimes we're asked about our incredible relationship with Cigna and Evernorth, because there is at the contract level consolidation there, and it is north of 50%. But what I always remind folks is that that's at the contracting entity level. It's not at the client level, which is like the 2,000 plus employers that and entities that we work with, because when you are in the markets we're in, let's imagine you're the head of benefits at Acme Inc. If I meet you at an event and you're interested in Omada and agree to a pitch, in that process I might find out that you use Cigna or Blue Cross Blue Shield of Minnesota to administer your health benefit. It's very convenient for you if you can leverage that contract to deploy Omada. But equally, if I ask you, well, who made the decision to buy Omada, you'd say I did. I made the call to buy Omada. I just asked you to facilitate it on that contract with my plan. And so that's germane to ensuring everybody wins together here. The most important metric for us relative to any consolidation risk is, are our end clients happy? Because we win, the clients win, the channel wins, the contracting entity wins, like the ecosystem stays very stable there. And so that's always top of mind. And we work to be great partners, with folks that we do a little bit of work with and folks that we do a lot of work with. And equally, we've signed some great new big ones. I mean, we announced a relationship with CVS Caremark just in April. And so that's obviously another big one. And then we do work with a number of other quite sizable plans and channel partners.
And then, in healthcare, health data is sensitive. You're in a highly regulatory environment, especially when dealing with, commercial payers and, Medicare and Medicaid. What's kind of the most significant regulatory or legislative risk that kind of keeps you up at night? And what are you doing to kind of mitigate some of those?
So most of our work to date has been on the commercially insured side. And so we've got about, as of the end of 2024, 14% of the self-insured market, 9% of the fully insured, and 1% of Medicare Advantage. And so Medicare Advantage has actually been growing. We really don't do work in Medicare fee-for-service, de minimis work in Medicaid. It's really managed government plans like MA. And so, we think that though it doesn't make up a material piece of our revenue now, we do think it's a sizable growth opportunity forward and such that does continue to subsist as thing in the U.S., which all signs are that it is. It's something we endeavor to take advantage of. So thankfully, we've not been subject to the subsidies on the exchanges and some of the ebbs and flows in the markets that others have seen, given kind of our go to market.
So we discussed it a little bit already about the competitiveness of the market that you're in. For investor or a member of ours that's kind of skeptical and saying, you guys are smaller, kind of still up and coming. Why not just bet on a larger, more integrated player that I can kind of just ride with and I'll be okay. What would you say to them that gives an investment Omada more attractive than just taking kind of that road?
Well, I mean, the first thing I love to remind people about is that Omada is a provider. And so we contract as a provider, we bill through claims, which means we're out of like the employer's wellness budget, no different than any other like hospital, but we don't have the CapEx of clinics and, the buildings we got to put up and all the dynamics and fee for service billing because we've designed our operational revenue model to be very, very different. So that's kind of the first thing. And then, it's still relatively early innings in this next generation digital health companies. They're actual providers. This is in some ways digital health 2.0, where 1.0 was a software solution on top of an existing market. 2.0 is provisioning the care, proving that it works, publishing studies, like delivering it through some combination of people, technology, hardware. That's very difficult and operationally intricate to build. And the scale of the problem is so much bigger than the scale of Omada. And equally, if you look at other players that might be analogous to Omada, in most data sources that you look at, Omada's the biggest voice there. And so I think for an investor that believes that, look, chronic disease care needs to be different than it is today, that believes that it's a continued problem for the country, and if you have an investment thesis around that, there aren't a lot of places to look on the enterprise side. Hopefully, there's more in time.
AI is the big buzzword that everyone's talking about. A lot of health companies are also discussing AI, and to me, I've always found that AI in health is just it's almost like it should be a natural fit to being able to streamline and make things just better. But technology in healthcare has always been a challenge for numerous reasons. What is your focus on AI? How is it helping your company? Much of what you do too, has your human delivered coaching and some of the clinical studies and things like that. But how is AI helping you, and how do you see it helping you in the future as well?
Well, it's so fun because we're able to execute on things now that, like, I remember in the early days with my co-founder, like sitting in Dolores Park talking about what we would love the product to do someday. We only dreamed about then. Like, we're doing that. And I mean, we just launched a whole lot of member-facing AI capabilities. Of course, the basics, like ability to take pictures of your food, have it analyze macronutrients aligned with our nutritional philosophy. Other things like support you in a motivational interview, like all these unique AI forward things. Equally, we feel that our care teams and the people side is hugely important. And, I think in the arc of healthcare, in medical school, they always talked about it as like the art and the science. I think that over time, the models will be the science and the people will be the art. And what we talk about and think about is you listen to our members and they don't say they feel accountable to large language models. They don't feel accountable. And that's an important thing in healthcare, to have that human that you feel is a real person that's supporting you. That's, hey, Sanmi, let's talk about what we want to do together for the next 2 weeks. I'm gonna come back with you in a week. Let's do this. Like, that accountability really matters. I mean, 9 times out of 10, when you talk to someone who's gone to the gym that has a personal trainer, they know how to do the exercises. Wouldn't matter if it's the machines there and the writing on the wall or some model. It's like they go because they're going to disappoint someone if they don't show up. Yeah. And it's very important in health goals, which are not always easy, to create a psychology of not just doing it for yourself, but like in partnership or for somebody else. And I think the people are very important in that.
Yeah, that's a great point you make about accountability to a chatbot or to AI model. It's like, yeah, it gives me the plan, it gives me everything I need to do. That's awesome, but is it going to check up on me frequently? Is it going to ask me how I'm doing? Maybe in the future, who knows? But we do feel this responsibility to another human on the other side, on the phone or Zoom, about what we're doing if the plan's working, and that connection is there where you know that coach is really interested in your in better health outcomes for you. So for sure.
Yeah, I think that intersection is so exciting. Like what where can you create the compassion with the people, the sophistication with the models? How can your care teams leverage the models and delegate the tasks and the things that they don't need to be spending time on?
Yeah.
And maybe like the models do a better job. Like I have a 6-year-old and a 4-year-old. I basically stopped defining words for them because the voice model, like a voice ChatGPT model, does a better job. Like try to define perceptive to a 4-year-old. That's like a hard word to define. I'm like, all right, AI, help me out here. And I'm like delegate word definitions to my kids. And that's the future we're living at. And it's not one or the other, it's the blend.
Yeah, absolutely. What's kind of an example, I'm fascinated too by the hardware and the technology that you have within your platform as well. What are a couple examples of where the patient care and the technology kind of work together and help improve outcomes?
Yeah, with the hardware piece. So, when we talk about our hardware, I always say that anything we build has to pass the Sean Duffy's mom test, which means it needs to be set up out of the box, like automatically. So my mom's incredible at using an app, but I don't think she's going to be pairing a Wi-Fi scale with her home network. And so, for our scale, blood pressure cuff, glucometer, we've picked cellular and worked with our manufacturing partners to create these great devices that just work. That's really neat. And then, having that feedback cycle of like the data meets the care plan, meets the care team, meets the chart, meets the goal, meets the content, it really does matter. And so this ecosystem, like hardware, software, people, really, creates, per my comments before, kind of the full stack experience for our members that yields the stickiness, yields the clinical outcomes that we can then publish, to gain enterprise traction.
Yeah, because it's one thing to have the technology, the wearables, the scales, gather all that data in your app or whatever, but then sometimes for a patient it could just be too much and we don't know what to do with it all. It's great to have all this data, but then how do you use that data to actually execute on your plans and better your plans?
And sometimes it doesn't help. Like if you really dig into the psychology of obesity, sometimes people don't want to step on a scale. They don't, and so you need the human side and to recognize like how to frame that. So per your point, the data alone, doesn't get you there, evidenced by the fact that we still have an enormous chronic disease problem in the country.
Yeah. So, you're a high growth startup right now, and eventually you're going to become a sustainable public company that's much larger. Leadership and culture is very important in kind of getting to that scale. What's kind of the most important cultural value they're kind of working to instill the company? Given that your company is very much on the patient care and high touch, high empathy kind of model. How are you instilling that culture as you start growing employees and your partners?
Yeah, it's a great one. So before this podcast, I got off of what I always do, which is a CEO welcome with all new hires. And so this is kind of a chance to, say hi directly to that initial cohort. And, what I highlighted to them and what I always highlight is how important as a company grows, it is to create a values-driven organization. And that doesn't mean be nice to one another. Like in fact, if you don't spar on what the most important thing is for your customers, for your business, and have vigorous debate, that wouldn't be living values. But values are really, behaviors that create, positive culture. And so we care about those a lot. They're values like cultivate trust. They're values like seek context, act boldly, remember why we're here, and each one is associated with key behaviors, and we embed those into performance processes, hiring processes, you name it. That I think is important in any organization to grow durably and in a way that continues to support positive outcomes for the business. But it's especially important in healthcare because it's a very enterprise healthcare is a very risk-averse buying market. And what I told the new employee vintage right before this podcast is that like your internal values, they will permeate through to the external world. And your customers will feel them. They might not, you might not be able to know them explicitly, but that really matters in that durability of trust, which leads to new opportunities with your clients, your partners. It leads to client retention. It leads to growth. It leads to good references. It's really it really compounds. So you hit on something very important.
Yeah, absolutely. If we look 10 years out, and Omada Health succeeds wildly, kind of achieving everything you hope for, what's kind of the single biggest change you think you have brought to the American healthcare system?
Yeah, I think it's the care model that we always should have had in chronic care. It's the one where still to this day, the like thing I remember most were these moments before incorporating where we sat in the home of people with diabetes, with obesity, and and the healthcare academic would have said they have care, but then you ask them if they feel like they had care, the answer is no. So it's I think it'd be great if it was just viewed as a default expectation that you have the right care model that's tailor-made for the condition you're suffering with, and that's just not the case. And so we think of it as an obligation to swing as hard as we can at this because it's going to be very hard for the existing healthcare system to do it, given the constraints of fee-for-service billing, and just kind of the operational models and the technology models. And so, our hope is that instead of being an exception that someone gets longitudinal, care, it's the rule that they do, and the rule is Omada, hopefully.
Mm-hmm. As we kind of close up, I like to end off on a lighter note, and I couldn't help but notice in your bio that you're spending a lot more and more of your free time learning how to build and fly first-person view drones. So tell me a little bit more about that.
Yeah, for sure. Yeah, if any of you are out there, little tinkers, I highly recommend FPV drones. That kind of started during COVID, where everyone was looking for something to do, on a Saturday that didn't involve friends, and so you can buy all the pieces online and the frame and like the circuit boards and the motors and solder them together and program them. And it's an absolute blast. It's flying these is like playing a video game with consequences, because if you crash, you got to fix your toy. So it's an absolute trip, and it's a fun stress reliever.
Yeah. I bought a drone for my son who's 12 years old now, and it's so technical, and like getting something might happen, get stuck in a tree or something happens, and you got to fix it, and you got to constantly update the software. It's keeps you on your toes.
Oh yeah, and there's still a piece of me that feels like a 12-year-old boy when it comes to RC hobbies. So it allows you to scratch that itch.
Yeah, absolutely. Well, thanks for joining us here and taking the time out, and we are looking forward to seeing the success of Omada Health, and hopefully it makes the healthcare system and for patients and users just a little bit more seamless and easier.
Oh, thanks so much. Yeah, what an honor to be on, and wishing everybody listening an amazing holiday season.
All right. Thank you, fools.